The grip of the third wave, as President Uhuru Kenyatta calls it, is the reason behind the new raft of stringent measures he announced earlier today. Kenya not only recording a spike in the number of infections, but also hospital admissions and deaths over the last 1 month. And as Raquel Muigai now reports, the country's infection rate is unfortunately but casually settling at 22%.
What was meant to be a year of recovery for a majority of Kenyans following stringent COVID-19 measures that to a level curtailed growth in 2020, President Uhuru Kenyatta's announcement feels like reliving 2020 once again. Well, thanks to the close of COVID-19 that are seemingly uprooting whatever hopes many drew for the year.
The end of January 2021, our COVID-19 positivity rate stood at 2.6%. By Monday, the 22nd of March 2021, the positivity rate had jumped to 19%, and indications by our experts is that the positivity rate is now settling at 22%.
In January, 4,380 new infections were recorded. In February, the number will slightly increase to 5,525. By 25th March, the number of infections had already shot up to 20,710, a worrying steep for the president.
If you test 100 Kenyans for COVID, 20 will be positive. This compared to January this year, when only 2 would have been positive.
The script would entirely read the same for the number of deaths recorded. January and February recording 93 deaths each, whereas in March, 236 deaths will be recorded. That is until 25th March to be precise. The already weakened health system slowly but surely beginning to feel the strain as more critically ill COVID-19 patients seek admissions at various intensive care units in the country. As the virus makes itself comfortable within the Kenyan population, 70% of the infections being recorded in the country are from the cases within Nairobi, Kajiado, Nakuru, Machakos and Kiambu counties, all now placed under one zone identified as disease-infected area.
Out of every 10 positive cases countrywide, 6 are from Nairobi. This wave is expected to peak in the next 30 days with more than 2,500 to 3,000 cases being reported daily.
And true to that, 2,008 cases have been recorded by the Ministry of Health within the last 24 hours out of a sample size of 11,360 persons. That a representation of 17.7% positivity rate. 6 more people have succumbed to the disease, raising the total number of fatalities to 2,098. According to medical experts in the country, the peak of the third wave is expected to flatten in mid-May, just 60 days away. Raquel Muigai, Citizen TV.